Dear colleagues, this is intumescent cataract. It's a fairly straightforward case. The cataract has no fluffy cortex, so the pressure inside the bag is not that high. It is high, but it's not something that you should worry about. The rexis is easy to make. You saw that there was no cloud of cortex that came out of the bag, and with a grease rubber forceps it's an easy job to have a round nice capsular rexis. Having one of the paracenteses enlarged and use it as a main incision, and then taking out the cortex on top of the nucleus and doing a horizontal chop. The nucleus is kind of a soft leathery nucleus, if we can say that. It's starting to become leathery, but it's not a strong leather, it's just a soft type of leathery nucleus. And another horizontal chop here, and we take out an eighth of the heminucleus, and then we have more space to maneuver the pieces inside the bag. Notice the bevel that it's always towards the piece that I want to emulsify, and using the two instruments to rotate and separate entirely the two heminucleuses, and then with more chops making the pieces smaller and smaller. The nucleus is very easy to get emulsified from the bag. I like to keep the bevel down when I do phacoemulsification or sideways. In this way I ensure that it's more in contact with the nucleus, the bevel of the phaco needle, and have more area where to engage and emulsify the nucleus, and I believe it's lowering the ultrasound in this way that we use to emulsify the pieces. And at the end of the case you have a clear cornea the next day, and the patient then we are happier. So the entire nucleus is out already, and then cleaning up the bag for the last remnants of cortex using an AC maintainer and aspiration needle. It's pretty much just small fibers of cortex that are still remaining in the bag, and switching the instruments and aspirating to the main incision to make sure all the area of the bag are clean of these fibers of cortex, especially underneath the main incision. Sometimes it's harder to access that, but polishing it and teasing it out, you can aspirate that also. Pushing down the iris to release the anterior synechia. In this intumescent cataract, if we do gonio, we're gonna see the anterior synechia present in most of the quadrants. Injecting the IOL This is a hydrophilic IOL. It's implanted straight into the bag and then cleaning up the viscoelastic, pushing it out, and injecting some meiotic agent and an air bubble, and that's the end of the case. Thank you for your attention.